everyone. Yeah, my name is Philip, Special Needs Teacher. I graduated from Maseno University. I have a vast experience of over 5 years. So, before I start the discussion of the topic of today about parenting strategies for behavioral issues of kids with autism, I want to thank the organization that invited me, that is Autism Connect. Autism Connect is a voluntary group based in Mumbai, India, that was formed by parents, as professionals, and caretakers. It was basically formed to discuss matters pertaining people with special needs, especially autistic people or autistic children. So in Autism Connect, we'll bring you the new ideas, the therapies that has come into the environment that can help our society, or that can be used to modify the behaviors of our autistic kids. So today I will take you through our topic, which is parenting strategies for behavioral issues of kids with autism. So before we go into details of these strategies, I want us to look at the reasons why autistic children behave unexpectedly, or what are the things that trigger their behavior, the unwanted behavior. So if you look into that, we can look at the first thing that may trigger their unexpected behavior is being unaware of other people's wants, desires, and needs. So when they can't read what you want, they can't read your feelings, they can't read your emotions, this one can trigger their behavior that is may interfere with the surrounding. Second, if they have trouble in communicating their own needs, their own wants, and their own desires. For those kids that are unable to speak well, some people call them non-verbal, but we call them those with communication difficulties. So if they can't communicate their needs, they can't communicate their desires, they can't communicate their problems, they will find a way of communicating. And that way can be either being hyperactive, throwing tantrums, okay? So those are things that can bring the unexpected behavior. Number 3 is finding it hard to predict other people's behavior. Most of the autistic kids, they get difficulty in predicting what you want, predicting how you behave in the society. Number 5, having underlying physical, neurological, mental, or emotional health issues that impact the child's well-being. So some will suffer mentally, they have mental problems, they have neurological issues. So these problems, if you are a typical person or a typical parent, you might not be able to read what is going on through this child, and the child might behave unexpectedly. Number 5 is being hyper-vigilant or unable to self-regulate or thinking before acting. Self-regulating is controlling, they are unable to control themselves. In case they want something, they overreact according to the situation rather than stopping and thinking of what they can do or the action they can take before. Another one is lack of or delayed in developing theory of mind. What is this theory of mind? Theory of mind is the understanding of another person's knowledge, beliefs, emotions, and intentions. Using the understanding, they can navigate social situations. So theory of mind, if they are unable to develop that, they cannot, you have not trained them, or the child is in a situation at that early stage where he cannot develop how to think, understand the situation within the environment. It can trigger that, among others. So let's look at these behaviors. We have looked at reasons why these kids can behave unexpectedly. Now let's look at some of this behavior. They are not limited. There are so many, but I will look at into a few of them that we'll put into consideration. So the behaviors of concern includes verbal aggression. What is this verbal aggression? They can be threatening, abusive language, etc. So a child in a normal environment can just pop up from nowhere and just talk to you abusively, or threatening you, if you do this, I'll chop your head, something like that. The other behavior of concern is physical aggression against objects. You find a child in an house can start just throwing things in the house, breaking TV, throwing cups, everything, breaking things, and what have you, causing chaos in the house. Those are behaviors of concern. Another thing is physical aggression against self. Physical aggression against self. What is this? These are whereby they stimulate themselves. You find a child is banging the head. You find a child is scratching everywhere. A child is pulling off the hair. If it is the beards like the way I have, pulling off the beards out. Those are the behaviors of concern. Another one is visual aggression against people's appearance. This is where the problem comes. You have your child, you go to visit your auntie, or you visit somewhere, a new environment, then this child come across a new person, a new face. Maybe to you, the person has dressed well, but to this child, the person is very ugly, okay? The person is bad physical expression, or whatever the case. So this one can be one of the unexpected behavior or behavior of concern. Another one is lack of initiation, not leaving the house. If you leave your child to sit here, most of the parents say, if you go to assess their child, they tell you, oh, my child can concentrate well, my child can, wherever you put him, whether in a chair, you'll find your child is there after 2 hours or after how long. That is lack of initiation. This child cannot initiate, cannot start either to play or to think of going somewhere. The other one is physical aggression against other people. Most of the kids, they don't know how to play. If they're playing, they hit each other, they slap, they punch, they pinch, all those ones. Inappropriate sexual behavior. Some will talk, have sexual talk at early age, exposing their body parts. Some will touch their private parts, they concentrate in touching that. Some will walk with their bum open, okay? Those are the behaviors that are of concern. Then we have another one, perseverance or repetitive behavior. This is where a child will ask you one question now, in the evening, tomorrow, frequently asking the same question. If it is rocking or if it is fidgeting, the child will fidget. Some people say they stimulate. It is okay, they stimulate, but according to a normal person, according to the parents, they don't expect the child to behave in that manner. Then wondering of what is not prohibited or what is not expected from this child. So the child might be asking several questions. I'm not allowed to go to this area, because when the child may be sitting on a sitting room, then the child goes somewhere, then you will start, oh, I don't want you to go to the kitchen. I don't want you use the word no, 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 or don't. The child will start wondering, oh, what is going on? Then last but not least, inappropriate social behavior. That is poor hygiene, social skills, how to interact with people in the house or in the society, or in case you go to supermarket, how will your child behave there? So feel free, if you can ask a question on those concerned behavior. You can address them, send them there. I will always read them, then we see how to respond to them. So now let's look at our topic today, which is strategies now. Let's look at what the things that our parents can do to reduce or try to eliminate the behaviors. First, we look at number one is PBS. PBS means positive behavior support. What are these positive behavior support? Positive behavior support are approaches that incorporate different theoretical framework and various strategies, focusing on improvement of quality of life and reduction of the behavior. So, how can we apply this positive support, behavior support? So, in any environment, most of the things that trigger these behaviors may be environment, working activities. So, what can we do to improve these positive measures that can help us reduce the behavior? We can apply number one, removing or reduces the triggers that cause the behavior. For example, if in the environment bright light can make a child to become irritated, something like that, you reduce the bright light. If the environment is not friendly, the child needs a quiet environment, is affected by loud noise, take the child to a quiet place. Then number two, adjusting the environment around the person, the same thing we have discussed. Then teaching and encouraging new skills to communicate their wants and needs to avoid behavior of concern. So here I will encourage the parents or the teachers or the caretakers to use the total communication. In case your child has not developed some speech, kindly use total communication. Total communication whereby you use visual. We encourage, if it is in school, we use PECs, use of picture exchange. If it is time for going to the toilet, you draw a timetable. At 10, there's someone poo-pooing somewhere. Then if it is time for drinking, you draw someone holding a cup. So the child will look at the watch and you have a clock on the wall. So this one will reduce the behavior whereby when the child wants something, it becomes aggressive. Then we have motivating the person to use the new skills in different environment to get the needs you want. So if you want a child to behave the way you want, then you have to motivate this child. How do you motivate the child? You maybe give a reward, or you use the verbal. The reward can be physical or verbal motivation. Thank you, good boy, good girl. You are able to manage this. Wow, congratulations. So this child will feel like, oh, I'm being welcomed. Then reduce or removing any benefits they are getting from displaying the behavior of concern. So if your child is fond of crying from morning to evening, first after identify what is making this child cry, and if at all you can reduce, if it is a reward, reduce it or remove it totally. Tell the child, today if you cry you won't get this one. It is not a form of bribing, but it is a form of teaching this child to become independent. Then number two, we have just discussed PBS, that is positive behavior support. Number two, we have talked of modifying behavior. Modify the environment to help the behavior. That is number two. Modify the environment to help the behavior. How do we modify this environment? This is how we can modify. Moving items such as putting food or drinks where the child can easily reach it. For example, if your child sometimes get angry and maybe feel like the stomach is empty and the food is hanged somewhere far, you can usually reduce where you usually keep the food accessible to the child. Then using visual schedule to help the child know what is going to happen, for how long, and and in order. So the visual timetable, we have talked of it. Visual timetable is whereby you draw and you plan prior to what the child is required to do. So when the child wakes up, the first thing the child meet on the wall is brushing. The brush is drawn there, someone is brushing there, the child will use that one to cope up. That one will reduce the unwanted behavior, the tantrums. Then using better and simpler communication to ensure the understanding. Most of the parents of caretakers, they get irritated and they get angry so fast when their kids become hyper or throw tantrums. So we are advising you use the simplest, and let's avoid the word no, 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 no doing this, don't. no doing this, let's avoid so much, but we use the simplest words possible where the child can understand. Then showing what the expected behavior are, such as lining up at the supermarket. You must show your child the expected behavior. For example, if you are going to your child to the supermarket, this child must know that when you are going to supermarket, the only thing is required is to make a straight line. That is first. Then you pick things one by one. There's checkout. Then putting things in a line, or when in classroom, hands must be carried up if you are to say something. So those are the things that you have to show your child to modify the environment where the child is. Ensure they can easily access sensory tools. For example, ear defenders. Okay. So if your child is getting irritated by loud noise, so get the ear defenders or the earplugs you put here to modify the sound or the pitch into which the sound gets into the ear. Then another one, changing the time of the day depending on the activities to be done. If this child is fond of just one activity all the time, kindly as a parent, try to change the activity depending on what you want to do. Change the time, change the environment, so that the child can know, when I grow up or when I become independent, it is not a must that I should do everything at the same place. That is bringing up the behavior of concern, because if you concentrate a child in a one place activity, then try to do transition, you will be in a problem. Then another one, changing an everyday item, e.g. if the child is brushing, you change the brush, you change the toothbrush, you change the hairbrush, so that you change the weaving clothes without the tags. Sometimes the child is wearing clothes with the tags here. What does that indicate? Most of people, I see them putting the name card here written, like me, I'm called Philip Oloo. Philip Oloo, autistic child, then written there number 07, something like that. Why are you doing that? At times you change. Some people say, when my child gets lost, this child will grow up knowing very well that there must be a tag. Even in the house, if you remove this tag, you will be in a problem. So you keep on changing things for this child to know that environment is not stuck. You can change at any time. Then we go to ABA, Applied Behavior Analysis. So when we look at applied behavior analysis, what is this applied behavior analysis? These are things that therapists desire to do and discourage the unwanted behavior in autistic kids. So therapists use rewards to encourage a patient to develop communication, language, and other skills. In doing that, they modify the behavior of the kids. So, but on some situations, the ABAs, to me, under some circumstances, I don't encourage it. Why? Because the ABA, or applied behavior therapist, concentrates on behavior problems only, rather than helping the child to develop other skills. So the therapists dwell much on behavior problems. They are forgetting that we are training this child to be independent. So what they do with the behavior, they fixed the behavior, forgetting the feelings, the thoughts, the emotions of this autistic child or this autistic person. So use the behavior as a reward to reinforce a certain behavior selectively. Then we'll go to another one. That is using positive reinforcement to encourage behavior. It is under ABA. So that is why I said we use selectively. So under selectively, I will use two things. I will use positive reinforcement. Then I will use what we call ABI. ABI is antecedent-based interventions. So those two is what I want to explain under ABA. So if I use the reinforcement is whereby when a child does this or does a desired behavior occurs, you give a reward. or you praise the child. So under this, I want to talk about the reward or the positive reinforcement part of it. So whenever you are doing or you are applying positive reinforcements, ensure the following. Make sure the reward is something that will motivate the child or will motivate the autistic person. If this child likes toys, and this child is maybe operating in a different way, bring the toys that will motivate the child to eliminate or reduce the unwanted behavior. Combine the token with verbal praise, e.g., I really like the way you washed your hand with the soap. I really like the way you dressed up, okay? I really like the way today you did this. You did really well staying with the one at something like that. We were in the soap. I really like how you made a line in a supermarket, something like that. Then in the beginning, use the positive reinforcement every time they demonstrate the new skill that you want. Then gradually, as you give the reward, gradually demonstrate the new skill. So when this child is now coming to the reality that I usually being given or being praised when I do this, so this unwanted behavior will fade away. So when it fade away, gradually remove the positive reinforcement. Then don't be tempted to offer a reward before the behavior. Most of the people, when the child is crying or throwing tantrums, throwing everything away, then you come up with a pen. Maybe if you stop, I'll give you this pen. So the child will look at you. Oh, there's a pen carried somewhere, and will grab the pen, or you will give the child the pen. Don't give a reward before. Don't give a reward before the expected behavior is shown. Then, if positive reinforcement is not working, review it to look at why and adjust it where necessary. If you are giving a reward as toy and it is not working, move to another thing. So that is under ABA selective one. We have used positive reinforcements. Number two, we are using antecedent-based interventions. That is ABI. How do we use this ABI? And someone will ask, what is this ABI? What is this antecedent-based interventions? So these are typical things, strategies that are implemented following behavior assessment. You take your child for behavior assessment, then the assessor will tell you, depending on the course of your child's behavior is this and that and that. It is the environment, it is the activities taking place, it is how you handle your child, it is maybe the facial expression the child is getting, or it is the general surrounding. So this one, we call it antecedent-based intervention. You will modify the behavior based on the assessment that is done. So what are these ABIs? So the ABIs include changing educational activities and materials. So if you are using toys, you can change to toys, go to drawings. If the child is bored with the drawings or at the house, maybe the child is fond of watching YouTube on kids, you can transit from that one to another thing. Then incorporating choice in educational activities. So when you are a parent or a teacher or a caretaker, then the child is maybe has come from school with the homework, give a variety of the choice to this child. So incorporate these choices so that the child can have a variety to choose from. Then planning ahead of time for upcoming activities. Let the child know prior what will happen next, so that if it is a matter of bathing, from bathing, this is what I do. From putting on clothes, we go to church. Then from church on Sunday or maybe Saturday, we do this and that, or maybe Friday. So you have to plan prior. That is under antecedent-based interventions. Then modify and reinforcing schedules. Ensure the schedule is not that rigid or not that commanding to the child. These are human beings, so just assume someone is playing with your feelings and forcing you to do whatever they want, contrary to your expectation. Even if you are just this autistic person, autistic child, you'll have to react. So what do we do? Adjust the schedules to suit this child. Then set expectations to be consistent and follow through during activities. So you must have expectations, and these expectations you have to follow. We started last year doing away with the crying. So maybe to some, let's say last month. So from last month up to now, what have you achieved? Follow up and adjust where necessary. So those are the selective two topics under ABA. So I want us to look at another thing, that is cognitive behavior interventions, CBI. What are these cognitive behavior interventions? Most of people with autism are taught to examine their emotions, to recognize when negative thoughts are assessed or escalating in intensity. So the cognitive usually deals with the mental strategies, how this child think. Then the thinking can initiate a certain behavior that maybe you don't want. So what do we do with these cognitive activities? First of all, you have to recognize the positive thoughts on this child. You have to recognize the wanted things, not unwanted, the wanted things. So after recognize the wanted thing, you can use the wanted things to apply to do away or reduce the unwanted things. Use the thought of the child, read the emotion of the child, psychologically study this your child. At this particular child, if I see the child is doing this, emotionally or cognitively this child want to do this. So apply that where necessary. Then another one will use discrete trial teaching. What are discrete trial teaching? Yes, so let's discuss this discrete DTT, discrete trial teaching. Discrete trial teaching is instructional approach used to teach skills in one-on-one and controlled and structured environment. So if you are teaching your child at home, the first teacher is parent. That is why it is written parenting strategies. The first teacher is parent. The second teacher is the caretaker. The third teacher is the teacher in school that is going to handle this child. So as a parent, a caretaker, and a teacher, you have to go together, you work together. So before your child starts going to school, you have yourself to use the discrete trial teaching, whereby you use one-on-one discussion, one-on-one approach to your child. If it is a matter of talking, this one required repeating instructional trials that have a definite beginning. So if you are doing something, it must have a beginning and it must have an end, and you do it repeatedly, so that the child will get used to what you are doing, will get stimulated, and eventually the desired skills or behavior will be reinforced and achieved positively. Because if you are fond of repeating to this child, you play, then we have to share when we are playing. If it is a child with lack of flexibility of behavior, so when you want to teach on sharing, you keep on repeating this sharing, so the child will get to know, oh, whenever I have something I have to share with one another, I have to share with my brother. Then the next strategy is extinction strategies. What are these extinction strategies? Extinction strategies are used to reduce or eliminate a challenging behavior and relies on accurately identify the problematic behavior. So this extinction, you go directly to the problem. Okay, you don't gamble with your child. If the child is poo-pooing on himself or on herself, that is what you address. How can I teach this child to stop poo-pooing on himself? How? Or susuring on himself? You set the time. After 3 hours, digestion has taken place. Let me take the child to the toilet. After maybe 4 hours, you take even if it is night, take the child there and look at your watch. Is it 30 minutes or after 20 minutes? You do that frequently. So under this extinction, the consequences that reinforce the behavior is removed and withdrawn, resulting in reduction and extinction of the behavior. So if the child is behaving unwantedly and you look at the consequence, what is causing this one? Or if the child is laughing after doing this, can we reduce this? Yes, reduce that. Extinct means you remove or you do away with or you eliminate what is causing the problem. Then we have what is called MD. MD is just modeling. MD is modeling. So what is this modeling? It involves the demonstration of a desired target behavior resulting in imitation of the behavior which should ultimately lead to the person with autism achieving the imitated behavior. So how do we use the modeling? Modeling means imitating. Let the child, or there are two things involved in modeling. Modeling can involve frustration to the child. Modeling means positive to the child. So if you are fond of repeating the unwanted behavior that child is doing, for example, if the child is fond of just fidgeting in the house or rocking in the house, then you go before the child and start fidgeting and rocking. The child will look at you and get intimidated or irritated and withdraw it totally. That is modeling. Second to modeling, if you want your child to copy and imitate the wanted behavior, repeat that behavior and imitate it regularly so that the child can see, and eventually the child will copy that and start imitating and doing. Then we have PRT. What is PRT? Pivoted response treatment. What is this pivoted response treatment? Pivoted response treatment entails the following: motivation, self-engagement, self-initiation, and the ability to respond to multiple cues. This treatment focuses on challenging the behavior in the pivoted area. So what are these pivoted areas? Pivoted areas means it is based on the key concept that there are pivot parts of the body that causes a certain behavior. So maybe the child has not developed, if it is speech, the child has not developed speech, so communicating is bringing unwanted behavior. If it is social skills, the ADL, that is daily activities of daily living, poo-pooing, showering, brushing, all those ones. So if the child has not developed this, there's some body part that is causing this. Okay, so address those ones and motivate those ones. Help the child to self-manage himself or herself. Then let the child, if it is training, potty training, you are taking the child to the toilet regularly. That is initiating. One day the child will just come up and go and poo-poo and go and do help himself or herself. Then we have another thing we call another thing we have self-management. We have talked of it under pivoted response. So how do we teach this self-management? It involves teaching children with autism to distinguish between appropriate and inappropriate behavior and reinforcing appropriate behavior. So this is whereby you have to help the child to distinguish what is bad and what is good. If the way the child behaving is good, congratulate the child. If the way the child behaving is bad, that is what you address. So let the child know, if I do this, this is bad. If I do this, this is good. So it is applied mostly with evidence-based practices. So you can use a video modeling. You can use a visual support. So if you see the child is behaving unwantedly, you can take a video of a good behavior and show the child, this is how you should behave at this particular time. That's self-management. This is how you should go. Use the visual one, draw the toilet there, draw whatever. So when the child sees that, this is what I should do. What is that? Self-management. Even if you have the clothes, after removing your clothes, you should not just throw them anyhow. Collect your clothes, put in the bucket. The bucket is drawn there. So the child reaching the house from school will look at after this, I do this one. So the child will remove the clothes, self-management. Then another thing is task analysis. What are these task analysis? It involves breaking a complex skill into smaller components. In a chain, we call it chaining of behavior. What is this chaining of behavior? You don't give your child complex or overwork. If you are a teacher, let me now address the teachers. If you are a teacher and you want the autistic child to perform a certain task, break this task. If you are giving, for example, you are giving 20 sums to the rest of the class or the rest of the learners, break this one for this child. Give him the first 3, then step by step give him 2, then until you reach the 20 that you have given people. Don't give 20 to everyone and include this child. It will get frustrated of the workload and start throwing tantrums or bring the unwanted behavior. So as the smaller steps are mastered under task analysis, people become more independent to their ability to perform the whole scale. So step by step, you start with the small, you graduate it slowly. Even if you are a parent and you want your child, don't give the child too much instructions. Give step by step instructions, so that the child can integrate himself slowly or herself slowly. Once these small steps are mastered, I'm assuring you that this child will be independent and will have that ability to perform itself. Then the other one is time delay. How is time delay a strategy? Time delay is used to phase out the use of prompts during instructional activities. So some people used to prompt their kids, hey, you're supposed to do maths. Hey, right. So time delay is used to phase out that activity. So how do we phase out this activity? It is applied through a brief delay which is provided between the initial instruction and any additional instruction or prompts. So what do we do it? Delay, if you have a work that is set within a time frame, let's say do English between this one to this one, between 10 to 11. So you can delay the time to give this child time to think and know what to do or how to handle the question that you have given. There's another one called PP, prompting procedures. How do we use the prompting procedures, the PP? This one encapsulates any help given to people with autism to assist them in using a specific skill. So if you want a child to use a specific skill, how do you do this? Or how do you use the prompting procedures? You may use verbal, you may use gestural or physical prompts given to people on the spectrum. This one will help them engage fully in the activities that you may want. So when you are using the prompting procedure, what you do, you can use your verbal to be kind, firm to whatever you want the child to do. You can use gestures. These people are very intelligent. Sometimes they are above how you think. So they will just read the facial expression, what you want, or they will look at your hand and I say no. So the child will just use, oh, this is no. Some teachers use, meaning you keep quiet. So those are the things, the gestural things you can use in prompting. Not necessarily you go and tap the child. Hey, are you doing the work? You can ensure the child is looking at you. That is also concentration, eye-hand concentration. So the child will look at you and see what your facial reads or the gestures you are using and help the child to adjust. This one now to parents. Stay calm when interacting with your child. I know it is very difficult, especially when they are portraying the behaviors of concern. I'm advising you to stay calm. Collect yourself when you are giving what? Or instruction, or when you are interacting with your child. The child will see, daddy or mommy is very jovial to me, very happy with me. So even if you are correcting something, be calm. Stay calm. Then take advantage of the teachable moments. What are these teachable moments? Okay? Let me give you an example. If the child snatches a toy or snatches something from another, teach this child how to use the words to ask for the toy or to ask for the food. So you take advantage of that time the child is portraying the behavior. If the child is grabbing things, okay, or is annoyed of maybe some word from the fellow one, so take that advantage and to teach. Use your own words to ask for the food you want. So what do? Say, help me with food. Because the child is in need by that time, will struggle and try to verbal out some words to say something, maybe need food, something like that. Then always give choices. Always give choices. Why do I say give choices? Some people are very rigid. When they give work, it is that. Despite the relationship between this child and what the task you are given. So give this child an alternative. So provide an alternative to the unwanted behaviors. If the child gets overstimulated from sensory input, let me say large crowd, bring this child to a quieter place to distress this child. Maybe the child is shouting, making noise, crying because of the crowd. So what should we do? Give this child a best choice. Take him to a quiet place so that the child can distress, can remove stress from the crowd. So unless someone has a question to ask, feel free to ask me any question so that we can move on. So those are some of the strategies I wanted to share with the parents, to share with the teachers on how we can modify the kids' behavior. Let me say thank you. Looking forward to meet with you or to share so many things with you. Let me read the comment. Yes. 17 strategies now live. Yeah. Comment on the positive behavior. Yes, a post that yes, I'm seeing. Okay, you can send the comments. I have to respond to them. So feel free to share any question you have so that we can discuss them. In case there's no question, I will say thank you so much for your time. And I advise you to, whenever you need something to do with the Autism Connect, usually go to Autism Connect wall. I told you prior it is based in Mumbai, India. So in Facebook you'll get it. You go to YouTube, you'll get Autism Connect. You go to Instagram, it is always there. So usually check, you'll see we are posting so many things, teachings, new therapies, anything that comes across. So you check there, you'll get to know more about autism. Then whoever may want to discuss with me one-on-one, feel free to ask question. You'll find me on Facebook, Philip Oloo. Go to YouTube, Philip Oloo, Special Needs. Then you go to Instagram, you'll get me, Philip Oloo Akal. I'm there. So we will discuss more if you interact. Thank you, such informative session. That is Nakutula Mbeje. I have no question for so far because I'm driving. Thank you so much. Then comments. Nakutula, thank you. I'm seeing people are streaming, they're watching. Yes, thank you so much. Feel most welcome. Let's meet next time.